There are more than 7,000 homeless people in San Francisco. Really impossible to address all of their medical needs despite millions and millions of dollars that the city pours into this problem.
But at one clinic, doctors are doing what they can to keep this crisis from turning into a catastrophe. Can their work help us build a better Bay Area?
ABC 7 News reporter Leanne Melendez followed a small team of doctors, and this group, they are in the trenches.
They certainly are. And you know what comes to mind? God bless them, really. What they do. You know, we know that taking care of themselves, their health is not always a priority for many living on our streets or in shelters. There are so many other distractions and concerns they are dealing with. So we're going to show you now some of the people who care that the unhoused stay somewhat healthy and, yes, alive.
When it comes to medically treating the unhoused, the unconventional has now become habitual. Every Friday, a small medical team from the San Francisco Health Department comes to treat patients in this isolated Bayview encampment.
What do you see out here?
We tend to see things that we see in the clinic, but they're often more severe because they've been untended to for longer. People with more severe mental illness, more severe addiction and substance use disorders.
And the reason you come out here, what is that? Instead of them going to the clinic?
There are lots of people who can't manage being inside, even for small amounts of time, who their mental illness is so intense that they're too paranoid to come in, they're too weak or too ill to come in. This is a patient I've known for a long time. We're drawing some blood and talking about some medications we restarted.
Dr. Catherine Taylor treats anyone willing to be cared for. It takes trust.
How many days do you think in a week have you taken it?
This type of homeless health care is an effective way to keep them from ending up in the emergency room. After her weekly checkup, Juliana Amos spoke to us about being unhoused for the past 5 years.
I assume that you don't interact with many people. What does it mean to you for doctors to come to you?
It means a lot because I don't like going on the buses, a long bus ride, down there, and sometimes I forget to come in, so it's good that they come out here.
If they didn't exist, what would happen to you?
Probably dead.
Despite her circumstances, we couldn't help but notice how the American flag is the first thing you come across.
We like our freedom out here, so we know what's going on out there. We don't want to be stuck in the SROs where everybody's doing their drugs and dying.
Those unhoused or living in SROs are closer to the downtown area and have access to a network of outreach teams.
We staff between 8 and 9 vans a day, so 24 hours a day, 365 days a year. Last year in 2023, we responded to just over 11,000 calls.
Here's the outcome of their interactions with those struggling on the streets. 25% are taken to the hospital, another 25% are transported to a clinic or shelter, and the remaining 50% either don't meet the criteria for a psychiatric hold or they decline their services.
When you reach out to somebody, is it frustrating when you know that person needs so much help and intervention, but they don't want it?
Yes, of course, but that's the thing that we do the best is building that trust, building that rapport, and just being consistently able and showing up.
Because someone showed up is why Joseph Peterson is alive today.
All I did was kept drinking and using drugs. So therefore, after many years of doing that, my legs started having complications with my legs, so they had to amputate my feet.
What made you decide, I've had enough?
Because he kept checking on me, and he was coming up there to check on me to see how I'm doing, and that helped me a lot. I said, somebody really care about me,
Today, Peterson has permanent housing and helps out at the Maria X. Martinez Health Resource Center, a clinic dealing specifically with the unhoused population.
This building opened a little over a year ago. We're finding is really working for people.
The clinic is strategically located in the south of Market area and sees between 60 and 70 patients a day.
They can come in to see the dentist and then find out, oh, you have a psychiatrist here, and they can see the psychiatrist the same day.
All in one.
They also offer addiction treatment.
Why do you continue to volunteer here?
because they took the time out to help me, and I don't mind helping them back.
So the city's health department runs 14 primary care clinics, and any homeless person can go to one of them. But really, that's the only one that helps them get stable and get other care under one roof. But they're not open 24/7. They close, the clinic closes at 4:30, you know, so there is a, long gap. But as one outreach person told me, we don't have enough people, staff, nurses, doctors to care for all these people.
Yeah.
Another challenge.
It's hard to keep up, right?
Yeah.
And many probably think it's a thankless job.
Yeah.
All right, Leanne, thank you.